Plus, right now, Indiana Governor Eric Holcomb is updating the current stay-at-home order that's set to expire today. So let's listen in.
That we would take to fight it. For these past weeks, I've said that we were only at the beginning of what would be a long race, and there are many miles to go. Today, I can report that thanks to the discipline and actions of 6.7 million Hoosiers, we are ready to move ahead in a measured way. I want to share those measured next steps that we'll take together to begin to reopen our state. But first, before I do that, I need to say at least a few words of remembrance and appreciation to reflect on those we've lost and to thank the heroes who've been on the front line saving lives, every one of them, despite great personal risk. For those who know me, know that I'm a bit of a history buff, and I'm reminded in this very moment, in the Gettysburg Address, when Lincoln said, "The world will little note what we say here," and added that no speaker, even one of his power and eloquence, had the power to dedicate, consecrate, or hallow that sacred ground. Lincoln was, of course, acknowledging that words are inadequate to the task of honoring the fallen. Words cannot capture the pain and grief so many of us are feeling right now. When we provide our daily updates, we use a lot of numbers. The number of COVID cases, the number of hospitalizations, the number of deaths. But let us never, ever forget for 1 second that the more than 1,000 Hoosiers we have lost to this disease are not numbers. They are our grandparents, our parents, our children, our friends and neighbors and loved ones. Each life was precious, and like ripples in a pond, each touched scores of people in ever-widening circles. We are all grieving, and the depth of our grief is commensurate to how much we love them. And so we will honor their memories by never forgetting them, their smiles, their laughter, their love, their wisdom, their good works, while they were here with us. We will also never forget the countless heroes who have answered this call during this crisis. At a time when we all have been touched by such loss, we have also been filled with immense pride and gratitude at the countless acts of generosity and sacrifice coming out in every corner of our state. On behalf of all Hoosiers, thank you. Thank you to all the healthcare workers who put their lives on the line every day to protect us. When the pandemic came, the call went out to Indiana's nearly 17,000 licensed physicians and more than 150,000 nurses. Joining them were thousands of more volunteers. That includes the nurse practitioner of 30 years who was about to retire but sprang back into action. The Army veteran who works full-time in a hospital but added nights and weekends so he could do even more. The mental health therapist who said she would do anything to be of service. In our greatest hour of need, you all are there for us. And of course, that includes our own dream team of medical experts, Doctors Bach, Sullivan, Resniak, Weaver, Kaufman, and Doss. The Lieutenant Governor and I, thank you. And we also share our appreciation for all those essential workers who are keeping us safe, keeping us fed, keeping the lights on, keeping the shelves stocked. Our police officers and our firefighters, our farmers and food producers and supermarket cashiers, our long-haul truckers and delivery drivers and trash collectors, folks we took for granted just a few months ago. All of you are working unselfishly so we can continue to be living without a far worse disruption. I share our appreciation for the ministers and priests and rabbis and imams and all those who are comforting us in our suffering and grief. I also share our appreciation for everyone who has taken this virus seriously and kept their distance despite the hardships. Your patience and discipline have helped keep the terrible toll from being even worse. Finally, I want to share my appreciation to all Hoosiers for rising together in our time of crisis. There have been too many acts of caring, kindness, and ingenuity to share right now. Everything from companies and individuals donating food and money to making needed medical equipment and researching treatments and testing to working overtime to do whatever it takes to serve those most in need. But I think it was Captain John Melling of the Fishers Fire Department who captured it best. The good captain said, "For all the madness this pandemic has wrought, it has also brought out a deeper humanity and empathy than the likes most have seen in this lifetime. It is an honor serving a community in a state which not only touts Hoosier hospitality, but lives it." John's comments are not isolated. All across Indiana, we have witnessed a spirit of cooperation and caring for others that has touched my heart. May this spirit of appreciation for one another carry on long after the torment of COVID-19 is behind us. We are doing this together, and together we will overcome this disease and come out a stronger Indiana. Now let me turn to the next steps to getting Indiana back on track. I know this has been a very challenging time for Hoosiers. COVID-19 has disrupted our lives beyond description, brought grief to so many and financial difficulties to many more. When we planned our initial response to this global virus, our goal, our mission was clear: slow the spread and flatten the curve in order to protect our healthcare system from a surge. That response remains data-driven, and that will continue to be our practice as we consider a sector by sector reset with the goal of getting Indiana back on track. We will follow 4 guiding principles to determine how plans to reopen various sectors of the economy move forward. First, that the number of hospitalized COVID-19 patients statewide has decreased for 14 days. Our current data shows us that as a state, COVID patient admissions have decreased the past 2 weeks. Second, that the state retain its surge capacity for critical care beds and ventilators. Currently, statewide ICU bed and vent availability has remained above 40% and 70%, respectively, for the last 2 weeks. Personal protective equipment, or PPE, is critical for businesses as they resume operations, with masks in particular demand. The state is working with Hoosier companies that have already converted their lines of work to PPE or currently supply such materials. We're developing the Indiana Small Business PPE Marketplace to provide reliable access to PPE for small businesses that need help to comply with this new safe workplace precautions. Businesses and nonprofit entities with fewer than 150 employees and registered to do business in Indiana will be eligible. More details on this program will be forthcoming. In addition, we will be distributing $300 million to counties, cities, and towns via a population-based formula, which is the first installment from the Coronavirus Relief Fund. The third principle is that we can test all Hoosiers who are COVID-19 symptomatic. At the outset of the virus, Indiana deployed a dozen strike teams to congregate settings, especially nursing homes, to quickly respond to suspected COVID cases. These teams will continue to play a vital role in keeping Indiana on track and will focus on detecting new cases as early as possible. To help in the early detection of new cases, the state has partnered with OptumServe to add 50 testing locations in strategically located parts of the state. These sites will enable over 100,000 more Hoosiers to get tested per month and aid in the early detection of new cases. Hoosier employers, employees, and consumers can have confidence anyone concerned they may be sick due to their symptoms or having been in contact with someone who is will have the ability to get tested. Which leads me to my fourth and our guiding principle for getting Indiana back on track, which is to contact all individuals who test positive for COVID-19 and expand contact tracing. We will aggressively track new cases through a centralized contact tracing program to help slow the spread of the virus. While ISDH, the state health department, in cooperation with local health departments, has engaged in contact tracing since the first positive case of COVID-19 was reported in early March. Centralized contact tracing will begin May 11th. This will enable us, the state, to ensure all future cases are tracked and recorded in a uniform and timely fashion. All Hoosiers who test positive in the future will receive a text, email, and a call from one of the state's over 500 contact tracers currently being onboarded. These tracers will identify other Hoosiers potentially at risk and help provide resources those individuals need. So, to ensure we can make steady, continued progress, getting Indiana back on track, we will continue to watch our number of hospitalized COVID-19 patients, make sure they're diminishing, that we retain sufficient critical equipment, PPE, that we're able to test all citizens who might be symptomatic, and that we can track those who test positive. Given the trends moving in the right direction on all four fronts, I'm ready to announce the next steps. We have developed a 5-stage roadmap. I said earlier we have a lot of numbers. And that is with our collective efforts. Those efforts will help us reach the goal of having Indiana back on track by July 4th, Independence Day. Of course, this roadmap is subject to change. New guidance provided regularly, and the more that is known about this disease every day may alter our course. Since March 24th, we've been hunkered down. We're calling this stage, Stage 1. During this time, essential manufacturing, construction, infrastructure, government, business, healthcare, and other critical businesses and operations have been open while K-12 school buildings remain closed and all their activities canceled. Since Monday, Hoosiers have been able to resume having elective medical procedures. Stage 2 will roll out over the next 3 weeks. Nearly all of Indiana will move to Stage 2 this Monday, May 4th. Marion and Lake, our two most populous counties, may begin Stage 2 on May 11th to ensure our new testing and contact tracing programs are up and running. Cass County, which recently had an outbreak, may start Stage 2 on May 18th to make sure they don't overwhelm the area healthcare system. As we work to get back on track, we must still protect the most vulnerable among us. That's why in Stage 2, Hoosiers 65 and over, and those with high-risk health conditions who are the most susceptible to the coronavirus, should remain at home as much as possible. In Stage 2, we'll be easing restrictions in, again, a measured way. Although local governments may impose more local strict guidelines as those conditions dictate. We are lifting the essential travel restrictions and permitting social gatherings of up to 25 people following the CDC's social distancing guidelines. State government offices will begin to open for limited interaction with the public. In addition, the remaining manufacturers, industrial, and other infrastructure operations that had not been considered essential will also be able to open. Retail and commercial businesses will open at 50% capacity. Examples would include apparel and furniture, jewelry, and liquor stores that have been operating as curbside or delivery only. Shopping malls may open at 50% capacity, with indoor common areas restricted to 25% capacity. Restaurants and bars that serve food may open starting May 11th at 50% capacity, but bar seating will remain closed. Personal services such as hair salons and barbershops, nail salons, spas, and tattoo parlors also may open May 11th by appointment only and must follow social distancing guidelines. Those who work in office settings are encouraged to continue to work remotely whenever possible. In fact, if anyone can work from home, we encourage you to do so. Before I discuss Stage 3, let me make this one point clear. Starting May 8th, for all 92 counties, Indiana worship services may also convene following specific social distancing guidelines. While those 65 and older and those at elevated risk will be asked to stay home. Our preference, my preference, is that you continue virtual and outdoor services. And church leaders, we need you to keep your congregations safe. If health indicators remain positive, on May 24th, we'll move to Stage 3. Individuals at risk, including those over 65, may venture out cautiously. Those who can work remotely should continue to do so. Social gatherings of up to 100 people may occur. Retail stores and malls may move up to 75% of capacity. Movie theaters may open at 50% capacity. And mall common areas such as food courts and sitting areas may further open at 50% capacity. Playgrounds, tennis courts, basketball courts, pools, campgrounds, and gyms and fitness centers may open with restrictions and social distancing. All the while, we will be constantly monitoring what is happening in every community across our state, real time. We will be looking at hospital admissions, how many ventilators and critical care beds are available in each region, our capacity to test more Hoosiers, and how our contact tracing system is working. That is the data that has guided us every day since this emergency began. And we're not going to let off the gas now. We will continue to monitor every day. And while we're hopeful that we have the momentum to move into this stage later in May, we will be cautious and make the best decisions for Hoosiers based on the situation at that very moment. If still on track, on June 14th, we'll advance to stage 4. We hope we can open up the stage even more in mid-June to get you back to even more of the activities that you and your family are used to and missing so much over these last recent weeks. In stage 4, face coverings will be optional, and social gatherings of up to 250 people may take place, and large venues may open with adherence to social distancing guidelines. State government buildings will reopen to the public. Professional office building employees may resume work at full capacity. Retail stores, malls open at full capacity with social distancing guidelines in place. Dining room service may be open at 75% capacity. Bar seating in restaurants may open at 50% capacity. Cultural, entertainment, and tourism may open at 50% capacity. This includes museums and zoos and bowling alleys and aquariums and the like facilities. Recreational sports and leagues and tournaments may resume, and amusement parks, water parks, and like facilities may open at 50% capacity. Our goal is to have all areas of the state reach stage 5 beginning July 4th. Now, even in stage 5, we will continue to do social distancing, but conventions, sports events, fairs, festivals, the state fair, and like events may resume, and remote work will still, of course, be optional. Retail stores, malls, restaurants, bars, nightclubs, gyms, and personal services may operate at full capacity. Restrictions will be lifted at amusement parks, water parks, and like facilities. At this time of the stages, we will decide how to approach the next school year. So Hoosiers, this is our 5-stage plan to get Indiana back on track. It's a methodical, step-by-step plan for steady progress, which we'll carefully monitor. You can read more about this at backontrack.in.gov. Now comes the hard part. As life starts to slowly return to that new normal, making progress towards being fully back on track will require constant vigilance from all of us as we lift restrictions and more people return to work, visit a store or restaurant, and participate in more activities. The number of COVID-19 cases will likewise increase. if we cannot continue to meet our 4 guiding principles, all or portions of the state may need to pause or even return to an earlier phase of our stay-at-home order. In other words, this is up to each and every one of us, all of us. A.J. Foyt, one of only 3 men who have won the Indy 500 4 times, was once asked about his strategy for winning. He said, "The race is won in the last 50 laps." He knew that the keys to such a long race had to do with patience and discipline and perseverance. My friends, I have seen with my own 2 eyes your incredible patience, discipline, and perseverance. And I've learned from this very moment of trial that there is nothing we cannot do when we work together. And I truly believe, because of what we will do together, future historians will look back on this moment and say, for Hoosiers, this was their finest hour. And now, Rachel, before we get to the Q&A, I did want to say, and I'm going to join Dr. Lindsay Weaver. Sadly, earlier this morning, Dr. Box lost her father, and Dr. Box is, we all know, and you all know by now, has been a rock around her, and we're going to be that rock for her in this time. So I would appreciate if you would keep Dr. Box in your thoughts and prayers if you're the praying type. And now we'll join Dr. Lindsay Weaver, and she will give us an update on the facts as they are on the ground today. Thank you.
So on behalf of the Indiana State Department of Health, we also would like to provide our sincere condolences to Dr. Box and her family on the loss of her father. He raised an extraordinary person who has been our fearless leader for the last 2 years, including these trying times. We owe her a debt of gratitude in this time of sorrow. Thank you, Dr. Box. I'm going to open up to questions.
Okay. All right, Rachel, you want to jump right in it?
Lauren Chapman, Indiana Public Broadcasting.
Hello, Lauren. Good afternoon.
Good afternoon, Governor. How's it going?
Very good. Thank you. Yourself?
Not too bad. I do want to ask, especially as we reach this point of reopening the economy, especially certain sectors of the economy, and as you said, that you do expect cases to increase. I guess the question that I have, and it's something that other folks have asked me, was kind of what was the point of the stay-at-home order? If we know that we are going to see an increase in cases, if we know as a result of reopening the economy that we are likely to see an increase in deaths, was the point to build in hospital capacity, or was it to preserve life?
Well, we've always said that we wanted to be in the position to be able to care for anyone that has been adversely affected by COVID-19. The whole point, to answer your question directly, is to make sure that we have the ability to do that and the resources to do that. That was the whole calling out to say, Hoosiers, we got to slow the spread. We got to flatten the curve. This thing cannot get out of control, as it has spun out of control in other parts of not just the country, but the world. And we'll let the facts speak for themselves. Those numbers that I referred to earlier, we have that at the moment under control. We're looking at a few areas of the state, happen to be the most populated areas of the state, Marion County, Lake County, and where we had an outbreak in Cass, where we've not lifted. But the whole point was to make sure the cases, look, without a therapeutic or a vaccine, unfortunately, Lauren, we're going to lose people all over the world. You can lock down the whole thing. So our effort going forward will be all about managing through this crisis. I'm praying for a vaccine, but we got to do what we can do right now. And we're taking the responsible steps and allowing folks to responsibly and safely return to some normal aspects of their life. You want to comment more from a medical perspective?
Right, yes, I agree. So the thing that was most important to us is that we know how to protect those who are most at risk. And so by doing everything we did, we are protecting people who are older than 65, people with medical problems. And additionally, we gave our hospitals and our healthcare providers time to prepare so that we have more hospital beds, we have more ventilators, and honestly, we just know more about the disease in this time so that we know how best we can care for people when they get sick.
Yeah, and might I just add that that's important also, the prepare part of it. We talked about that, you know, 2 months ago, 8 weeks ago, about prepare with a plan. And that's why today we're making this announcement that would take effect for most of the state on Monday. So it helps people go to backontrack.in.gov and review those guidelines to prepare. Now, last week I said, don't squander this time. You know, let's prepare to reopen as we can safely.
Jeff with the South Bend Tribune.
Good afternoon, Jeff.
Good afternoon, Governor. Dr. Box, I'm very sorry for the news of your father.
Thanks, Jeff.
Up here in northern Indiana in the South Bend area, there's been a lot of anticipation of your announcement today because South Bend's Mayor, James Mueller, and Dr. Fox, who you had on your panel here the other day, feel that they're not ready up here as you are down there and what you view the rest of the state as to reopen. They say that hospitalizations are still increasing in the South Bend area, as are positive cases. Repeatedly, again today, you said that there will be the ability for local communities to impose more strict regulations than what you're allowing in these steps that you're rolling out here today.
Sure.
Can you talk specifically about what power they would have to set their own restrictions locally, statutorily? Or?
Well, they long have, and this has been the case previous as well. I have said that I'll always, my reflex will be to support a local official, in your case, who you're referring to, a mayor, but we'll continue to partner with local prosecutors, et cetera. If they have more than those 4 guiding principles and they're measuring other items and take those into account, we'll in all likelihood support. I've said that in Decatur County, I've said that in Marion County, and we'll continue to take that very same approach. They have to act. Joe, you want to comment on that just local-state relationship and how we won't interfere with local jurisdiction if they want to take it further or stricter than us?
Absolutely. So under Indiana law, and we've put it in the executive order, I think we put a specific provision in the second stay-at-home order, in part because we had received questions about this. But under Indiana law, as the governor mentioned, local communities can be more strict in their requirements than the state's executive order. They can do that via ordinance or other methods. And so that is just how the law in Indiana works, and communities can take advantage of that if they think the circumstances that they're dealing with locally warrant it. Thank you.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hi, I just wanted to find out, obviously, what is the enforcement of all of this? This is very complicated and detailed, and for some counties it's different rules. Are we basically just relying on the honor system?
Well, I do honor Hoosiers, and I do trust Hoosiers. I'll say that at the outset. Obviously, we wouldn't be at this position, to be making this type of progress or announcing these new 5 stages, to be not just thoughtful about it, but confident about it. And yes, that's because 99.99% of Hoosiers have been doing the right thing and making a lot of sacrifices, by the way, in terms of their daily lives and their financial well-being, for that matter. I can tell you that we'll continue to, as Jeff's question, we'll continue to, whether it's at the PLA or IOSHA, the state, state police. We've had a number of folks saying folks weren't playing by the rules. We'll follow up on that. Local community will obviously have an enforcement mechanism as well. But it's really truly going to come down, Nikki, I will tell you this, there is no state in America that has enough law enforcement, both state and local, to go chase down every rumor. And so this is incumbent, and it's going to come down to us. That's what I said about 2 or 3 times, I think. I mean, it's going to come down to us if we stay on this track. If we continue to be responsible, play by the rules, get with the program, we'll continue to make progress. If people look for openings and shortcuts and believe that this virus won't affect them like it does others, then we may slip. And that will force us as a state to come over top and start suppressing again. That's not what we want to do. We want to stay on this path. And so, I mean, to answer you just directly, Joe, I don't know if you want to comment on this as well, but to answer you directly, it will come down to state, local, and most importantly, Hoosiers themselves.
Rob Burgess, the Wabash Plain dealer.
Afternoon, Rob.
Rob, you should be able to speak. We'll come back to Rob. Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon, Governor. As we open the state, I'm curious about childcare choices that people might have. Is the state expanding childcare as we open more offices and workplaces?
The Secretary of FSSA is making her way to the podium to address this directly.
Good afternoon, Jen Sullivan, FSSA Secretary. Childcare has remained open throughout the duration of the coronavirus response. We've been supporting childcares to be ready to reopen if they were unable to remain so during a slower number of children using this service. We have continued to support those who were primarily taking care of healthcare providers, first responders, and will continue to support the reopening for sufficient childcare as we move through each of the stages of the Reopen project.
Thank you, Jen.
Michael WBEZ.
Good afternoon, Michael.
Good afternoon, Governor, and condolences to Dr. Bob.
Thank you.
Governor, what more is being done in Lake County to prepare for perhaps an increase in cases once the order is lifted May 11th? And there was talk about a field hospital at one point. Is that still happening? And did you consult with Illinois officials about your decisions to sort of delay the rollout for Lake County? Thank you.
We have sent word to Illinois and to all of our neighboring states, by the way. I happen to had a earlier scheduled phone call with the governor of Kentucky and Ohio myself, personally earlier today, so I was able to share some high-level updates, not in detail like we all have right now, but kind of what I was thinking and talking about the 5 stages. We don't want anyone surprised. We are looking at what's not just the population center in Lake County, but we're looking across the border as well, and we want to be good neighbors with Governor Pritzker and the citizens of Illinois. We'll continue to do that, and as I mentioned to Governor DeWine and Governor Beshear earlier today. Brigadier General Lyles, you want to talk about the first and why we never stood up yet to date, had the need to stand up that hospital facility?
Thank you, Governor. Brigadier General Dale Lyles, Adjutant General, Indiana National Guard. So first and foremost, we are closely monitoring all of the capacity in the entire Lake County. And by keeping an eye on that capacity, we know when we will have to surge certain assets into the Lake County area to meet the demand signals that could be generated by an influx of the virus. And so currently we've stationed excess capacity at the Gary Armory, and we have that capacity ready to put in line if needed when it's called for. And so we'll continue to monitor all the signals, and if we see the demand signals, we'll work with the local agencies to ensure that we deliver the capacity at the right time and the right place.
Thank you.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor, and my condolences to Dr. Box as well.
Thank you.
As far as the 3 counties that do not see a start to the lifting restrictions on Monday,
Yeah.
why just on a county level? There's a lot of travel back and forth between the donut counties and Marion County. There's a lot of travel between
Yep.
Lake and Porter counties. Why are those limits only in place for those 3 individual counties?
Do you want to talk about the bleed or the spread or the containment and all the factors of travel that we take into consideration?
Yeah, so when we're talking, we look at regions of the state, we always want to pay attention to what are the typical referral patterns of different hospitals and hospital systems. And we're also looking at the increase in number of positive cases, which I do want to mention that as we begin to move about in society, we do expect to see an increase in cases. But what we want to continue to pay attention to are the other guiding principles, which are hospitals available to take in more patients, or they still have plenty of ventilator capacity. So that's why we're delaying in those 3 particular areas, just because of the number of cases, specifically looking at Cass County. And we're in constant communication with the hospitals, the hospital leaders in those regions to make sure that if there is an influx of patients, do we have the ability to move them around so that we can make sure that everybody is best taken care of.
Jacqueline Ryan, the Stark County Leader.
Good afternoon, Jacqueline.
Good afternoon. So my questions are related to mask wearing by the general public, and these probably would be best for Dr. Weaver, but anybody's welcome to answer. So my first question is just, what's the best method of sanitizing these masks, since maybe there's some people who aren't really familiar with what they should be doing in order to make sure that they're functional? And what advice do you have for stressing the importance of these to people who may remain skeptical about their effectiveness?
Right. So the best part about wearing masks is really that you are protecting the other people around you from yourself. So as we know that there are some people who are asymptomatic carriers, that means they don't even know that they're infected. They don't have any symptoms. So by wearing the mask, if you were to sneeze or cough or breathe heavily on someone, you're actually containing those droplets from going to somebody else. So that's the most important part of wearing those masks. And my recommendations for washing is wash it after your wear. So if you are going to the grocery store or you run out to a store to pick up an item, then I would wash it after that use.
Ryan Martin, the Indianapolis Star.
Good afternoon, Ryan.
Hey, Governor. My question is really about the current economic conditions. So with so many people losing their jobs right now, governors across the country are being forced to deal with 2 competing crises. There's the public health crisis, and then there's the economic crisis. So I'm curious, how does your approach outlined today seek to balance the state's approach to both of those crises?
Well, I mean, we've from day one taken a safety first approach to this, but we understand the well-being effects, as you mentioned or allude to. Your well-being affects not just your health, but your ability to provide yourself for good health. And what we don't want to do is entice people to go back into an unsafe area by being premature about any decisions that we've made. But we also don't want to be reluctant to safely re-engage and restart and get back on track. We believe that at this moment, in this phased approach, a very gradual, very methodical, step by step by step, where we'll continue to, as I said 3 or 4 times, monitor each week, each day, quite frankly. We were looking at numbers very late last night and very early this morning all over the state of Indiana. And so it's finding that sweet spot. This is a little bit of science and it's a little bit of art. And we think we got the timing right. By the way, you're going to start to see, I suspect, other states who are looking at similar numbers take similar steps. And you'll see states that don't see similar numbers not take those steps.
Cassie Garrett, Whitewater Publications.
Good afternoon, Cassie.
Hello, how are you?
Very good. And yourself?
I'm good, thank you. And my sincere condolences to Dr. Box as well.
Thank you.
Governor, you mentioned the strategy around the testing sites and their locations. And as we work towards getting to that 50 testing site goals, can you share with us a little bit about what that strategy looks like that's helping guide that decision as to where those testing sites need to be, if it's based on numbers of cases or if it's based on like a parameter so that it's available to people? And also along that same line of questioning with the testing sites, do we know yet when the portal will be open? I know that you can register 48 hours before, and there was mention of the portal and the 1-800 toll-free line coming soon.
Yeah.
Do we know yet when that will be available?
Yep.
Yes, so all great questions. First of all, we already know of about 84 sites across the state that are seeing patients to test them for COVID-19, whether it be a clinic or a drive-through. And we have all of those compiled on a map on our website, the coronavirus.in.gov. In addition to that, we're going to be adding those additional 50 sites. So our goal is to have 20 that are going to open up next Wednesday, and then 30 more over the next week and a half after that. So the portal, our goal is to have that open on Monday, and we're going to add those sites to the map as well. When we were choosing locations, we based it on population as well as the number of cases in that area. And we very strategically, my team looked at the entire state of Indiana and decided where exactly do we need to focus those places. And for the next 30, we even reached out to local health departments to help engage them so that they can help pick the best place for us.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I'm curious, with the timeline being different for places like Marion and Hamilton County, for example, we could see businesses on the north side of 96th Street open when those on the south side of 96th Street would not be able to open. So what would you say to some of those business owners that might be upset by that on the south side of 96th Street?
Well, I mean, again, we looked at the numbers, and you could pick a line north, south, east, west of wherever we are, and whether you're in Cass County, Lake County, Marion County, and ultimately you got to make a decision. And for Marion County, understanding that the testing that we have in place that's occurring here, understanding that the tracing program will be up and running on May 11th to have that centralized, uniform approach, we felt more comfortable with a May 11th. Now, again, I will continue to respect and work with Mayor Hogsett and his whole team. Dr. Kane will all be working hand in glove here toward the end of that lift, whether it's on our timeline or theirs, which is 4 days later.
Kathy Treader, Ferdinand News.
Good afternoon, Kathy.
Kathy, you have to unmute your
I'm
mic.
sorry, I clicked the wrong button. Apologize. And thank you. This has been a very informative session today, and I've appreciated all of them, Governor.
Thank you, Kathy.
My question is going to be for Dr. Weaver, and it's a question that has bothered me a little bit because we're getting so many different answers, and this is national actually, but affects us all. Some people say when you grocery shop, you have to take it home and wipe everything down with Clorox. Some say you do not. Some say to spray your mail with Lysol. Some say you do not. I've heard so many variables, and I feel like people would like to hear, how, all of us regular people that grocery shop would love to know what we should be doing.
Yeah.
Yes, I think that the reason there's so many variables is that there are some unknowns in that. So we do know that the virus can live on a surface. And so that is why I think some people are recommending that you clean off something that's been touched several times. That being said, if you do your proper hand washing, most likely you're going to be okay with those items that you're bringing home from the grocery store. And again, as I mentioned the last time I was on here, bring your hand sanitizer with you. When you touch something, then sanitize your hands, and then you can move on from there. We don't believe that by eating the virus, that's not how you're going to get it. It really is if you touch something and then touch your face or touch your mouth.
If somebody doesn't ask the state's budget director a question, I'm going to be, it's the first question I ask over the last 30 days is going to be today. But go ahead, Rachel, I won't intervene.
Adam Wren, Indianapolis Monthly.
Hello, Adam, good afternoon.
Good afternoon, Governor. Because we are opening on July 4th, that seems to be a somewhat symbolic date. You mentioned that this is part art and part science. How much of that date is the art? And would you be willing at any point during this process to press pause overall?
Yeah,
on the stages?
Yeah, when I say art and science, ultimately, the art of it is ultimately you know, like I said, we were up very late last night. People hunkered down in this building and up very early this morning. And part of it, the art of it, is making a decision, understanding that you have all the information that you can possibly get, and then effectively communicating it out to in this case, 6.7 million people who are waiting, who understandably are anxious about this day and the days forward. That's more of the art. The science will guide us. And July 4th, it just played out to July as we were looking at the data before us. But if, to your point, and that's a very, very, very important point, at any point, this is why we call it a roadmap. It's not just some slick word we're using. This roadmap, there's a lot of different ways to get to a point. And if a road washes out, you gotta take a detour. And if something washes out along the way, we're gonna have to take a detour, or we might have to put it in park. And so there are different gears to this. We just believe if we stay on the course that we're on right now and continue to make progress, which is reliant on the actions that we all in this together take. The state's going to continue to ramp up testing. The state's going to continue to ramp up tracing, all very important. But as I said at the very, very outset, we got to protect, in my mind, Adam, we got to protect two things here, two fronts. We have to protect the most vulnerable. We have to protect 65 years and older that the coronavirus, COVID-19, is disproportionately taking their lives. We have to make sure that they remain hunkered down, and we have to protect the resources that care for people in need. And we're doing that right now. However, we see no vaccine yet, and we see a lot of variables out there that could make us change course. But I thought, and I don't know how many governors around the country are doing this, to be quite honest, I thought it would be beneficial in receiving so much input on a constant basis from 92 counties that it would be more beneficial for folks to see how far out in the horizon we're looking and to see how optimistic, quite frankly, we are right now looking forward. And so that's why we went out to July. That's July 4th, yes, happens to be Independence Day, and it'll probably feel like a bit of independence in a different way. But that's not what guided us to that date.
Joseph Payton, WFIE 14 News.
Good afternoon, Joseph.
Good afternoon, Governor. I hope you all can hear me well.
Loud and clear, like you're here.
Just yesterday here in Vanderburgh County, some local health officials announced a COVID-19 prevalence study. It's with Deaconess Health System and IU School of Medicine. And over the next week here, they're going to be testing 1,000 people for antibody blood testing and nasal swabs to figure out how prevalent it is here in our local community. My question for you is, do you know of similar projects around the state that are happening like this, and how important will these results be for you all as you move forward and try to gauge whether or not this back on track process is doing what it's supposed to?
So as you know, we completed, well, I guess the first part of the completion of the Fairbanks and State Department of Health prevalence study across the state of Indiana. So the last day of testing was Wednesday. We're going to be doing some supplemental testing actually over the weekend to enhance that a little bit more. And I just want to say that all of this information is very important, but again, it is just really one piece of the puzzle. So we use this to inform with all the other data points that we're looking at to help us make decisions. And right now, as we're getting this information back and the data back on what we found with doing that prevalence study, that just kind of gives us a snapshot of time. And so really when we do further studies down the road, then we'll see how we're going. We can help use that to inform how all the steps that we're taking and talking about today, how it's going.
Our final question is from Dustin Grove, WTHR.
Dustin, you're welcome to ask Chris, the budget director, any question. No, I'm just kidding.
Hold on, let me grab my different notepad.
Yeah, thank you.
Governor, was there any discussion of reopening regionally as opposed to county by county? Is there any concern that, people in Marion County, for example, might go into Hamilton or Johnson or Boone County and kind of defeat the purpose of what you're trying to do?
Yeah, we looked at where the cases were, and we looked at the spread and tried to contain it to the best that we could in a geography that was thoughtful. And it turns out that Cass County, and I understand people live in Howard County that work in Logansport or in Cass County. And so you're obviously never going to get this thing perfect, and you're never going to be able to, and we're not restricting travel to essential businesses in the days prior. So that could have been the case anyway. But we've tried to contain this to a point to where we weren't overextending those restrictions. And Marion, Lake, and Cass, for very specific reasons that the data proves out, gave us pause. And so we'd rather get this safe and not be sorry.
Thank you for joining today's briefing. Details regarding Governor Holcomb's next.
And you've been watching Governor Holcomb's update on Indiana's coronavirus response, and we have just learned a lot of new details about how he plans to open up businesses in the Hoosier State. As he said before, it's rolling out in stages, and we are in stage 1 right now. Stage 2, though, starts Monday for every county except Marion, Lake, and Cass counties. All 3 counties are still seeing an increase in cases, and that's why stage 2 is delayed in those communities. Stage 2 lifts the essential travel restrictions, and it allows for social gatherings of up to 25 people. Retail businesses can open at 50% capacity. Restaurants have to wait, though, until May 11th to open, and then only 50% capacity. And finally, salons and barbers can open May the 11th, but they have to be by appointment only. The governor is also allowing worship services to start May the 8th, but he is urging churches to put restrictions in place and continue online or outdoor services. The governor also made it very clear that this doesn't supersede any local orders. If a county has stricter restrictions, residents should follow those guidelines. For example, Marion County stay-at-home order is in effect until May 15th. Again, this is just stage 2, which starts on Monday in all counties except Marion, Lake, and Cass counties. The governor did make it very clear that if things get worse after starting stage 2, and the plan will be altered. We'll have a lot more on that and other updates from the governor tonight on CBS 4 News at 5 and 6, and right now on the CBS 4 Indy News app.